So the medical community has killed me. Um, Basically, about a year ago, my leg started hurting, and I tried several times to go to the doctors to find out what was going on with me. Most of the time, they would ignore most of my symptoms, go after something that was easy to test and verify that nothing was wrong with me, and then they'd send me on my way. A lot of times they would just tell me that I was drug seeking, even though I never was looking for any sort of pain relief. I just wanted a diagnosis and see if there was something that we could do to make it go away. My left leg started hurting. It would start cramping. The next day, it would feel like I had done the world's biggest workout on that one leg, and it would be about 2 days I would not be able to put weight on that leg at all. And then on the third day, it would feel like nothing ever happened, and it would go on like this for probably 2 or 3 weeks. Sometimes the pain would be so bad that it would be in my groin as well. It felt like it was going from uh, the iliac nerve area of my pelvis down to my kneecap along the inside of my leg. And I kept trying to tell doctors this. I'd go to the emergency room. I'd go to doctors. All of them, basically the most in depth any of them ever went was they checked for testicular torsion. I was actually kicked out of the emergency room that night because I refused to accept that there was nothing wrong with me when I was literally crying in pain almost on the daily because of this. And yeah, so they never bothered to actually listen to any of the symptoms. They would go, "Oh, leg pain. Yeah, it's probably a pinched nerve. Oh, leg pain. Well, you can't really, test for leg pain. Oh, it's in your groin as well. Forget the fact that it's from my hip all the way down to my kneecap. No, 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 that's definitely testicular torsion. I'd just be out, gaslit completely every time. Finally, it wasn't until February 27th when I went in to see the doctor, not because my leg was hurting, but because I had a cough that wouldn't go away. This was probably 6 months after the leg thing had started. I went to see a doctor. It wasn't my normal doctor because he wasn't available. My GP, he's almost always booked out for a couple months in advance. This other guy, uh, pretty much you can see him same day or a day or two later than when you call, and there's a good reason why he's always available. He's not that good at his job, but on this particular day, um, he he decided to go ahead and get an X-ray and some blood work. Um, as soon as all that came in, his computer told him that I needed to go to the emergency room. I'm convinced it was the computer that told him because that man is not smart enough to figure out how to diagnose a cold. But at any rate, he said that all indications were that I had um, what is it when the lungs, the blood clots in the lungs. I can't even remember the name of it right now, but that's what he thought it was. Uh, but anyway, I go to the emergency room. They do some more tests on me, and come to find out based on the scans and the blood work, they were pretty well positive that I had cancer. The fact that it was in my lungs, and when I told them about my other history with my leg, they started to they did some more tests. They ran it on my ran X-rays on my leg and whatnot, and then determined that yeah, it turns out I had cancer. My leg is the primary tumor, and now that it's in my lungs, that it was the highest stage of whatever type of cancer it was. And by that, what I mean is it's not necessarily stage 4, because things like testicular cancer, which is what they thought it was, only goes up to stage 3, even if it's in a different body part. Whereas if it's something like spindle cell sarcoma, which is what I actually have, it goes up to stage 4. So I mentioned that they originally thought it was testicular cancer. We were we were at the emergency room. My wife and my dad were there because I'd been there for several hours, and I have the My Chart app, and so I was getting the results before the doctor came in to tell me anything. So the results came back, and it said that I had cancer. It mentioned the metastatic disease. It didn't say at any point it did say cancer. It said metastatic disease, and it mentioned infiltrates in my lungs, and that based on my race, ethnic, my race, my weight, my age, and all that kind of thing, that chances were it was testicular cancer. That was the jumping off point, I guess you could say. And I immediately started laughing when I heard that. And I told my dad, I was like, man, do me a big favor. Do not tell my brother that I have testicular cancer in my lungs until it is 100%. We know that's exactly what it is, because honestly, I don't think I'd ever be able to live down him telling me that I have chestnuts. I know it's a bad joke. It was funny at the time. It was the best I could come up with. But when the doctor came in, I was kind of laughing about it. I mean, there's no point in crying or feeling bad for myself. It is what it is, and if it was testicular cancer, it's pretty easy to treat. Unfortunately, though, doctors didn't listen to me until it was too late, and I went from, even with it being the sarcoma, spindle cell sarcoma. Had I caught it when I first started seeking doctors' help, I had an 85% chance of survival at 5 years. Once they finally decided to listen to me, I was down to 15. I went through 4 rounds of chemo. The protocol that they had me on, they had worked with Vanderbilt and is it Vanderbilt. It's the one in Nashville. Then there was UAB, I think, that's out of Birmingham, and something Anderson out of Texas that focuses on sarcomas. And the chemo protocol that they had me on, it was 2 different chemos. It was 7 days of a 24-hour drip. So I would have to be hospitalized for roughly 8 days because even though it was 24-hour drip, there was a 45-minute to an hour long pre-treatment that I had to take before they started the new bag of chemo. And if anybody has ever worked with IV drips, you put it in for 24 hours, it's probably going to get done in about 28 with all the issues and problems that those pumps have. But I was able to survive 4 of the rounds. It would be a 21-day cycle. So I'd go in. Let's say that I went in on the 1st. I would be released on the 8th, and then I'd have to be back checked into the hospital on the 21st to start my second round. And as I said, with the particular treatment that I had, it comes with a lifetime treatment of 6 rounds. If I could survive all 6 rounds, that's what they were going to do. And if I managed to make it that 6 rounds, I could never take that treatment again because the risk of it killing me was way too high at that point. Well, I reached that point at 4, and my cancer was nowhere near gone. So at this point, there's nothing they can do to treat me except for just palliative care at this point. And I'm now dealing with a lot of the side effects of that treatment. It extended my life by a lot, but I now have a lot more medical issues than I did before. But I got to be honest, having medical issues like my diabetes not being controllable far outweighs the fact that I should have died 6 months ago.